One, let's go.
Hi, everybody. I hope everybody is safe and well. Thank you all for finding some time today to come and meet with Andrew and discuss about the Dermapen do's and don'ts. So without further ado, let me hand over to Andrew.
Good afternoon and a massive welcome live from my lounge here in Paris to the teams in UAE and also in Bahrain. I'd love to say a huge thank you at this point for the collaboration between Dermapen World, AK International, but also Gulf Pharmacy Bahrain. You can see me on the screen, but I can actually see a whole host of producers and moderators who are all working to make each of these weekly catch-ups an amazing webinar experience. The format of these webinars is going to be a mini casual experience, which really is about tips and tricks, protocols, indications, combination therapies, getting more use out of your Dermapen 4, but now seeing greater opportunity and potential, particularly combining with your DP dermaceuticals. For those of you who I've worked with in the past, welcome back. Great to virtually see you again. And for those of you who've not met me before, I'm Dr. Andrew Christie, and I'm the clinical director and global medical trainer for Dermapen World, but I've also specialized in microneedling for the last 20 years of my career. Today's topic is about the do's and don'ts of a Dermapen 4 procedure, and is about creating greater procedural versatility, greater safety, predictability, but greater efficacy, not just as a sole Dermapen procedure, but also combination therapies, particularly with your DP dermaceuticals. The format for our sessions won't have any slides. We also won't have any presentations or PowerPoint coming through. So you are going to just see me, my lounge room behind, but of course I'm going to be using some props as well. To make the process a little bit more interactive, if you go onto the center of your screen on either your smartphone or your laptop, you'll see that there is a Q&A option, and this is the question and answer tab. And you can interact by simply typing in your question. Now, our turnout for UAE and Bahrain is unprecedented. So we have a couple of hundred attendees today. As such, when you write your question in, it's going to go through to our team of moderators. If your question relates into the topic that we're covering today, do's and don'ts with Dermapen 4, then this will get forwarded into my conversation box, which means I can see live your questions come through. However, because we've got so many people for today's session, and because we will be catching up every week, every Tuesday at 3 p.m. UAE time, and 2 p.m. for Bahrain time. This means that any questions which doesn't relate in today's topic, I can either cover in the next couple of weeks, or alternatively, the team at Gulf Pharmacy or AK International will be able to direct message and contact with you. This just means that we've got a more succinct training experience, but it also means that we keep on topic and also keep on subject as well. Likewise, please broadcast your experience with our webinars and with your Dermapen, and we would love to hear from you on social media. So for Instagram, it's AKI UAE for AK International, or Dermapen World UAE. Likewise, if you add in Gulf Pharmacy Bahrain, and then directly for Dermapen World, all in one word, but I would love to hear from you myself, and I'm Dr. Andrew Christie, all in one word on Instagram. However, we would also love to hear from you on Facebook as well, and this is AK International, Dermapen World UAE, Gulf Pharmacy Group, and you can add me as Andrew Christie. and we look forward to seeing your experience with these webinars. The topics will change each week, but as I mentioned, we will be here each Tuesday afternoon, 3 p.m. for U.A.E, 2 p.m. for Bahrain time. And so we would also love to hear your experience of where you would love these sessions to go, what you want to know, which topics, which indications, which combination therapies you would love to explore. And this will certainly influence our presentation and what we can share with you to maximize these events. Each session will roughly go for about 30 minutes and a maximum of 45 minutes, but it will include question and answer time at the end. So welcome for our first session, U.A.E Bahrain style, here today on Tuesday. One of the biggest misconceptions that we still see with microneedling right across the international market is this perception that the more blood you create and the more discomfort and trauma you deliver, then the better the results are going to be. So I first urge you, don't believe that more blood equals a better procedure. Scientifically, when I look at the origins and the developments of the microneedling story, one of the pioneers is South African plastic surgeon, Dr. Fernandez. He is behind the 3mm microneedling stamp, but also the 3mm microneedling roller. At this time, you can imagine that the focus really was on as much blood to be drawn as possible. This creates a lot of trauma, a lot of discomfort. However, in 2006, Dr. Fernandez, in conjunction with his German counterpart, Dr. Aust, reassessed a lot of this previous work from the 1990s and early 2000s and discovered that you can achieve the same level of collagen activation, collagen synthesis, collagen regeneration, and collagen stimulation from 3mm of depth as what you can with just 1mm of depth. So I want to show here that don't believe more blood equals a better treatment. More blood can quite often mean that you're working in the wrong part of the skin, subcutaneous. More blood means more trauma, which now delivers more downtime for the modern patient. This is not advantageous. We know and understand that if patients are feeling immense pain, they're not going to return for a second session, but we also know and understand that following a standard Dermapen 4 procedure, you should never see bruising. There should never be scabbing. There should never be any grazing, nor any track marks on the skin. So with this, by understanding that you can work more superficially to deliver the most beneficial results, now becomes an advantage. Tying in with this, I also want to state that don't focus all of your Dermapen procedures mathematically. Perhaps one of the most commonly asked questions I still receive every single day is, what depth, what depth, what depth, what depth, what depth, what depth? Microneedling and Dermapen procedures don't work mathematically. So we take into account that skin density changes from region to region to region on the face. Skin density changes also from area to area to area on the body. Your response to the needles is going to change from treatment to treatment, and aspects such as diet, but also medication, if you think of blood thinners, are also going to change your experience. So as such, rather than treating mathematically, if you treat and look for a visual end point, this is what's going to deliver the ultimate of pinpoint precision for every treatment, every time. So do treat based on what you see rather than based on the physical mathematics that you're dialing up into your Dermapen 4 device. How do I know where I'm working? If you see no blood, but no color change with the skin, your needles are on stratum corneum, and arguably you're not going to see any result for any indication. If you see no blood, but the skin is pink, then your needles are working in stratum granulosum epidermis. If you see no blood, but the skin is red, your needles are working in basal spinosum epidermis. Once your needles start touching into papillary dermis, this is going to be highlighted visually by pinpoint blood. And as your needles are delivered deeper into the hypodermis or subcutaneous, you're going to see as your visual endpoint lots of blood. So we understand that by treating visually, now we get far greater precision than what you get mathematically. So all you simply need to do is turn your needles up or turn your needles down to customize for each patient, for each indication, and also for each procedure as well. When I look at the value of your DermaPen, do understand that this is a highly valuable standalone procedure. In fact, microneedling arguably is the original pioneer of regenerative medicine. As such, the process delivered by DermaPen now activates release of the patient's own autologous regulatory growth factors to now activate and promote their own process of healing, repair, regeneration, and correction of the skin. The value of this, particularly for the U.A.E. and Bahrainian market, is that there is absolutely no heat in a DermaPen 4 device. So by removing the heat, this now means that this device is suitable for 100% of Fitzpatrick skin types coming into your practice, but also 100% of ethnicities coming into your practice without the risk of post-inflammatory hyperpigmentation. The power that you see with the DermaPen device, hence the size of the physical device itself, but also the fact that the needles are delivered cleanly at a 90-degree angle and exit cleanly at a 90-degree angle, by comparison to manual stamps or rollers, where the needles are turning, cutting, and arcing through the skin, means that DermaPen fractionally treats the skin, which means there is no ablation. As such, we do understand that by comparison to thermolytic or heat-based procedures, every patient is suitable for DermaPen without the risk of post-inflammatory hyperpigmentation. But what we also understand, because there is no ablation, the epidermis remains intact, your DermaPen is suitable for those patients who generally have a higher risk of fibrotic tissue or scar tissue formation. So do see your DermaPen as a standalone, successful, valuable individual procedure. This is not the poorer cousin for fractional laser. This is not the substitute for other procedures. This is not the cheaper alternative. This is the most effective method to promote autologous regeneration as both a standalone procedure, but also as part of combination therapies themselves. So we now see the value of DermaPen, but we now see the flexibility, but unlimited applications and success for our indications and for the patients that we are treating. To further enhance this process, I want to look at the philosophy of your microneedling and of your DermaPen procedures. The success of this is about creating great quality skin. So, as the original autologous procedure, these needles here, and there are 16 33 gauge needles operating at a top speed of 120 revolutions per second into the skin, now delivers an unprecedented 1,920 puncture channels per second into the skin. What this activates is the autologous release of regenerative growth factors, which means the release of epidermal growth factor, manages and balances the chemical cascades, and manages and balances the processes of keratinization and melanogenesis within the epidermis. The release of other growth factors, such as transforming growth factors, manage and balance the quality integrity of the dermis and the hypodermis, but the release also of fibroblast growth factor controls and reduces fibrotic or scar tissue formation, and the release of vascular endothelial and platelet-derived growth factors now manage and balance vascularity and angiogenesis and durability of that vascularity within papillary dermis, but also within the hypodermis itself. So do understand that DermaPen is promoting autologous regeneration that corrects, rejuvenates, regenerates skin function, skin quality, skin integrity, and the chemical cascades which occur to look after the durability of the skin within the epidermis, within the dermis, but also subcutaneously as well. As such, it's DermaPen which now promotes better quality skin. I look at very popular procedures across the international market, in addition to procedures common within the Gulf countries. When we consider something such as botulinum toxin, whilst it might prevent muscular contraction, it still has no capability to affect or influence skin texture, skin tone, skin quality, or skin integrity. So as such, whilst botulinum toxin prevents movement of the skin, if your patient has bad quality skin in the first place, then what they're going to achieve is bad quality skin which doesn't move. If we also consider filler, absolutely it will re-volumize and re-densify the skin. But again, if the skin's not of good quality in the first place, then all your patient will have is denser skin, but still no improvement to the physical quality. This is where the role of DermaPen microneedling, but where the release of regulatory growth factors now facilitates functionality, integrity, and now manages the chemical cascades to physically enhance and support the quality, the durability, and the structure of the physical skin itself. So again, don't believe that just by preventing muscular contraction, you're going to be able to fix skin quality. Don't believe by just revolumizing, you're going to influence cellular communication. But also don't believe that just by temporarily resurfacing the skin surface, that you're physically going to correct, manage, and rebalance the chemical cascades and processes that occur underneath. So as such, I see DermaPen as being an absolute essential to prep, to prime, and to enhance and influence and to manipulate the physical skin as a canvas and the physical skin as the organ to now enhance all of your other procedures. We now take okay skin to good skin. We now take good skin into great skin via preparation, via the release of regulatory growth factors instigated via DermaPen to now develop even greater patient solutions, even as part of combination therapies as well. However, this doesn't mean that our patients just rely on DermaPen and just rely on coming to see you in practice every month or every couple of months. The role of topical home care is paramount to support, to maintain, and to continue on the results that you achieve within your practice, not just with DermaPen, but with any procedure that you create. As an example, I have a look at the dentistry market. So let's think of teeth care and oral hygiene. With this, you need to clean your teeth twice a day. Toothbrush, dental floss, and toothpaste twice a day, every day. But we also know that for oral hygiene, you need to catch up with the dentist at least once a year. As such, the role of topical home care, and particularly with the DP dermaceuticals, now facilitates, like toothbrush, like dental floss, like toothpaste, as being a way to influence, manage, prep, prime, and look after your skin at home. Likewise, also, you, as the DermaPen practitioner, now become the DermaPen dentist, and you direct, guide, manage the overall treatment program. So we see that the synergy of DermaPen, but the synergy of home care now takes us from okay skin to now good skin with topical home care, Adding Dermapen, it takes us from good skin to great skin. Some non-negotiables. The number one most important product is sunscreen and reapplication 3 to 4 times daily, particularly when we consider the climate in the Gulf countries. The Cover Recover is a broad spectrum SPF 30, titanium dioxide and zinc oxide. This means no irritation, no sensitivity, and a physical sunblock, which will now filter through 97% of UVA, UVB, and minuscule amounts of UVC rays. Likewise, also the Cover Recover is available in a clear form, which means it's effortless for the backs of the hands or for any exposed areas, but the tinted formulas are suitable for coverage, touch-ups throughout the day, but for ease of reapplication without removing any makeup on the skin, but can also be used following any aesthetic procedure to disguise and camouflage any post-operative erythema or any post-operative edema. The formulation of the Cover Recover is so gentle and effective that in fact your patients can sleep in it. A couple of other non-negotiables that I look at and I do encourage for patients to use at home is to understand the value of a corrective product on their skin. So whilst cleanser and whilst moisturizers are very popular from a sales perspective, this is now honing in even further to products which deliver greater importance and correction within the skin. Particularly for the demographic in the UAE and Bahrain, I recommend the DP Dermaceuticals Bright Light, a potent blend of kojic acid dipalmitate, an oil-soluble stabilized form of kojic acid, which can be delivered into the skin as part of a Dermapen combination therapy, but also as part of everyday topical home care. I also look at the DP Dermaceuticals Retinol Active, which uses retinaldehyde, a concentration that is 400 times more potent than 1% retinol. This becomes an essential that is suitable for every skin to now promote active retinoid infusion without risk of photosensitivity, without risk of irritation, and without having to build up tolerance as part of your skincare regimen. So the support of DP Dermaceuticals and the support of your patient now combines in the best of topical home care to turn okay skin into good skin, but now the combination of home care plus in-clinic procedures with you as the Dermapen expert now takes us from good to great skin. Soon we will discuss how in-clinic infusion of the DP Dermaceuticals, but combination therapies with the DP Dermaceuticals Uber Pro chemical peel takes us from great skin to now phenomenal skin. So do support your procedures with home care. Don't believe that just one procedure is going to set the patient's skin up for life. Don't believe that just one procedure is going to conclude and reach and exceed all of the patient's aesthetic desires. It's a combination of regular procedures with you in practice, but a combination also of regular at-home care by the patient. Likewise, also, when I have a look at now extending and developing your Dermapen procedures, we now take microneedling with Dermapen 4 from regulatory growth factor release, plus collagen production, and also angiogenesis, but by combining in with DP Dermaceuticals correctives, this now means we have the best of microneedling, plus the best of mesotherapy and specialized infusion into the skin. It's these combinations that take us from great skin to now phenomenal skin. At no point do I ever substitute my DP Dermaceuticals for any serum or for any other moisturizer. The design of these products is so specific for Dermapen procedures that they all feature a specialized hyalofuse complex. This is a triple molecular weighted hyaluronic acid compound, molecularly weighted down to just 10 kilodaltons, which ensures not only smooth and ease of gliding the dermapen across the skin, but now also ensures that there is no risk of granulomas, facilitates excellent saturation and infusion administration of treatment actives into the skin, but also at the right pH and ingredient form, means no reactivity, perfectly tolerated by the skin, and no irritation or sensitivity. The formulation of the product is available in aseptic airless pumps, and the formulation is so pure that in fact you can eat the product. There are also some brand new updates to the DP Dermaceuticals range, which includes the new MG collection. And the new MG collection are 5 ml sterile vials, which can either be applied onto the skin topically and then dermapenned through, but they also link up flawlessly with a Luer lock syringe. And these can be used for traditional mesotherapy application in addition to infusion with dermapen. So quite simply, if a product cannot be injected into the skin, if a product is not designed for infusion into the skin, then don't dermapen it into the skin. This becomes the value of the DP Dermaceuticals, with specific solutions for anti-aging, specific solutions for scar revision, for stretch marks, for hyperpigmentation and melasma, for acne, but also for treatment of conditions such as rosacea. The combination of agents such as PRP or nanofat can also be advantageous, particularly for further autoglar skin regeneration, but even for indications such as alopecia. So we see that using the right product blend and combination now delivers the right result. But we also see the value of DP Dermaceuticals takes us from great skin to now deliver phenomenal skin. So the best of microneedling, growth factors, collagen deposition and angiogenesis, plus the best of active treatment infusion to now feed and add nutrition physically into the skin to prolong, to extend, and to increase your results for greater durability and reinforcement of skin functionality, skin quality, and skin integrity. The next tip and trick that I can recommend for do's and don'ts is do understand that the power of this device means that you can work quickly. By working quickly, it now means a more comfortable procedure for your patients, but now means that you have a more profitable procedure. You'll notice the size and the shape of the Dermapen 4 device here. If I compare that to an inferior microneedling device, both of these are microneedling, but both of these do not deliver the same performance. Firstly, do not judge a microneedling device by how many needles are contained in the needle cartridge. It doesn't tell you anything. The needles within the cartridge need to be driven by a powerful motor. So to determine the difference between a microneedling device versus the world leader and pioneer of automated microneedling, it's about assessing the relationship between the motor or the power plus the physical number of needles within the cartridge. You'll see from the size of the Dermapen 4, but the ergonomic design means that it possesses significantly greater power than what you see with an inferior device. This means that the device at full speed is operating at an unprecedented 120 revolutions per second, but with 16 33 gauge needles contained in this single-use sterile needle cartridge. This now means that Dermapen 4 delivers an unprecedented 1,920 puncture channels per second into the skin. No other device delivers this combination. No other device can maximize the relationship between motor and the needle cartridge. So I do encourage you that at full speed, do create a fast and effective treatment. So first speed is 66 revolutions per second. Speed 2 is 90. Speed 3 is 105. But speed 4 at 120 revolutions per second means that you can operate, strike, and administer the dermapen treatment quickly, fast, efficiently, and comfortably. The oscillation, the power that you hear, now diffuses nerve receptors, which means that you may not even require use of a topical local anesthetic. But the power also means that you don't need to administer dermapen slowly onto the skin. There is no advantage for slow, drawn out procedures. Fast stripes means fast administration. Fast administration means greater comfort and also reduces downtime. So work quick rather than trying to promote this as being a spa or beauty treatment. Working quick delivers comfort. Working quick now also ensures that all the patient will experience is 36 to 48 hours of a mild to a moderate sunburn in appearance and sensation. You will never see bruising, you'll never see scabbing, you'll never see grazing, and you'll never see track marks with the skin. Just to play around, however, with the speed, you're probably wondering, why are there 5 speeds? The 5th speed is when you actually take the device to the scar treatment setting. This is an automatic calibration. So once I'm at the scar treatment setting, you'll notice that the speed automatically reduces, and that is down to 60 revolutions per second, and the needle depth is 3 millimeters. The purpose of this, particularly for hypertrophic scars and drug combination therapies for burn contractures or for keloid scars, means that you can treat with an imprint technique. Imprinting is not the same as stamping. Stamping looks like this. It's practitioner dependent. But if you imagine my finger here is like a raised or hypertrophic scar, imprinting means that at a lower speed, you can hold the pen in position for about 3 seconds, 1, 2, 3, and then reposition at a multiple angle to now create a 3-dimensional treatment of raised tissue. By supporting the skin, you can also use this for highly wrinkled or sun-damaged skin, and also use this technique for striae. So understand that even if your procedure is not suitable for 3 millimeters of depth, you can customize this imprinting technique by simply adjusting to the depth that is required, and then ensuring that your speed, instead of being at speed 4, reduce down to the lowest, speed 1, and then instead of using a gliding technique, all you simply need to do is imprint in the 1 position. 1, 2, 3, lift up, and then re-angle 1, 2, 3, supporting the skin as required for this. Your dermapen is revolutionary because it is the world's first and only Bluetooth-enabled microneedling device. This means that it will sync in with your smartphone. It will also sync in with any smart device. Do see syncing as advantageous. Just like your smartphone downloads updates to increase and to affect its performance and its technology, just like your laptop also needs to refresh to increase performance, it's exactly the same with your dermapen 4. So by syncing, this now becomes positive so that your technology and your investment becomes just as valuable today as in 2 years' time, 3 years' time, 5 years' time. There is a 7-year warranty on this device. If you do see that the device needs to be synced and you have a patient lying in front of you, just wait 26 seconds and then the device will change screen and will then start operating again for you. If you forget to sync, eventually the device will tell you with the letter D, which means day, and then a number. So it may start at D25, which means day 25, D24, day 24, which means you've got 24 days to sync so that you can optimize performance. So always remember that if you just wait about 25, 26 seconds, the device will still work. So when you've got a moment and some spare time, then you can sync that with your smartphone to optimize performance and technology. From a treatment perspective, we understand that Dermapen facilitates a controlled micro wound healing response. As such, over-treatment is not advantageous. Over-treatment becomes risky for post-inflammatory hyperpigmentation, but over-treatment can also almost guarantee fibrotic tissue or the formation of scar tissue. We understand as part of the biological functions which associate wound healing that the inflammatory response is biologically resolved in a 2-week, 14-day time period, which means your more superficial Dermapen procedures can be treated as often as every 2 to every 4 weeks. But if you're drawing blood, you're going to instigate the body's proliferative wound healing response, which therefore means if you're drawing blood with your Dermapen 4, then you should work in with the body's proliferative response, which means only treating every 6 to every 8 weeks. If you treat sooner, you risk the activation and release of pro-fibrotic growth factors, which can lead to scar tissue and fibrous deposition, but it can also risk the release and imbalance of melanocyte growth factor, contributing to post-inflammatory hyperpigmentation. The only thing that changes these parameters is if you are working with PRP or if you are working with nanofat. Because of the higher potential of growth factor release, this in turn reduces the release of profibrotic or precursors to scar tissue growth factors, which means if you are working in with Dermapen plus PRP or plus nanofat, you can actually treat as often as every 4 weeks. But otherwise, in conjunction with your DP dermaceuticals, with other mesotherapy or other products, every 6 to 8 weeks if you're drawing blood. This also means that you can now create customized treatment programs by simply alternating your procedural depths. So if you were to perform your first treatment with blood, then 4 weeks later, superficially with no blood, 4 weeks later, blood, 4 weeks later, no blood, you can customize your program so you can still undergo Dermapen procedures, but you're just not drawing blood more frequently than every 6 to every 8 weeks. I want you to imagine the flag of the United Kingdom called the Union Jack. And this is the type of technique you want to administer your Dermapen. So vertical, horizontal, diagonal 1, diagonal 2. Never use your Dermapen in circular stripes, particularly if the speed is low. This is going to rip and tear through the skin. So do use your striping technique, but don't be tempted to use circular techniques. In addition to Dermapen, plus your DP dermaceuticals to take you from okay skin to good skin to great skin, the combination therapy, even with the DP dermaceuticals Uber Pro, now delivers phenomenal skin. And the Uber Pro is an anabolic chemical peel, which means that it's activating a process to rebuild and to regenerate, as opposed to a traditional resurfacing peel, which is about removal of the skin. So as such, the Uber Pro is suitable for all Fitzpatrick skin types and ethnicities with no risk of post-inflammatory hyperpigmentation. And it is particularly focused for treatment of hyperpigmentation and acne, but a generalized refresh of the skin. Do apply your Uber Pro following your Dermapen procedure, not before. Because the anabolic chemical peel works more similarly like mesotherapy, the 1,920 puncture channels activated via your Dermapen now facilitate the infusion of the peel into the skin and the placement of the actives. The peel is a blend of mandelic, lactic acids, copper peptides, pyruvic, ferulic, hyaluronic acid, and retinaldehyde, plus niacinamide to now promote an exceptionally versatile mesotherapy agent to refresh, but to directly treat and target aged adult concerns, pigment, and also acne. So I do encourage to now upgrade and to create the ultimate synergy of solutions with Dermapen. So at-home skincare takes us from okay skin to good skin. Add in Dermapen takes us from good skin to great skin, but adding in the combination of home care and your clinical procedures infusing your DP dermaceuticals with DermaPen and use of your Uber Pro for safe and efficient and comfortable procedures suitable for all Fitzpatrick skin types and ethnicities now take us from great skin to phenomenal skin. This concludes the formal part of our mini webinar. I just want to have a look at some of the questions which have come through, and then I'm going to hand you back over to Belinda from AK International. I've been asked one of the questions, particularly for treatment of pigment, are we activating for more superficial procedures collagen production? Let's have a look at placement. When pigment goes wrong, the cell that is directly responsible is a melanocyte. The melanocyte lives in basal epidermis, and the melanocyte interacts with the keratinocyte to hand over the pigment capsule in spinosum epidermis. So when you're treating so superficially that your visual endpoint is red skin but no blood, it means that you're not reaching deep enough into the skin to directly intervene with a fibroblast or a collagen producing cell. So with this, it now means that if you want to create collagen induction therapy, you need pinpoint blood. Another question that's come through is, how much blood should I be looking for? I make this very easy. If you're treating scar tissue, if the scar tissue is red, blue, or purple, you want to look for pinpoint blood as your procedural endpoint, which means your needles are working within papillary reticular dermis. However, if the scar tissue is bound, if the scar tissue is old, or if the scar tissue visually is white, this is the only time you ever need to directly treat and target down to the hypodermis or subcutaneous, where you're looking for more blood as a visual endpoint. The final question that comes through asks, how frequently should I perform treatments? So just to reiterate, for your superficial procedures, pigment and acne, hypopigmentation, dyschromia or uneven skin tone, you can treat superficially no blood as often as every 2 to every 4 weeks. However, once you start drawing blood for scar revision, for anti-aging or for striae, treatment for the average adult is every 6 to every 8 weeks. That concludes my questions. That concludes our technical information. It's been such a pleasure to present to you in UAE and also in Bahrain. I cannot wait to catch up with you every week, and I look forward to seeing your success stories on social media. From the teams at AKI International, AK International, and the team also at Gulf Pharmacy Bahrain and DermaPen World, thank you so much. I'm going to hand you back over to Miss Belinda from AK International to finish up today's webinar session.
Hi everyone. Sorry, I was muted. I want to thank Andrew very much for his valuable time and presentation today. I hope that everybody enjoyed. If anybody have any other questions that we were unable to get to, you can definitely send me WhatsApp or email or anything like that. And I will send details of the upcoming webinars. And I hope everybody is safe, stay safe, and we'll see you again soon. Thanks again, Andrew. Bye.
Bye.